And you can see in this picture here, okay, I gotta go through this. This is really good for the students to have. This is what you would hook up, correct? She would hook this up to the computer, and basically she would utilize this and show them pictures and wonderful examples. That there is a lot of information for patient teaching, lots of patient teaching. So it's good information for the student to have so that they can utilize that to bring to clinical. Of course, during the lecture, there's a PowerPoint, but adding these pictures and showing the actual disease process is something that is a good thing for students to get in their head, and hopefully they will understand this stuff and keep it there. When we looked through everything, we're like, this is like on a 5th grade level, and we weren't very happy with that. And it's basically not meant for us as professors for teaching, as I said before. And it's really, really good. What we noticed is it's good for students who, where English is a second language for them.
I worked on Quizlet, and that just gave me some interaction with the students' question answers. And actually, I used this one in my class, and students liked it. They were, interacting, communicating, and they started using on their own. And they can also, question answers they can display on their iPhones while I was having that on. And I connected with Kaplan. Doing that, I got more information which I really wanted to. So when you get this list of questions, you can either play on the cards or scatter. Cards will give you this is the question, and then when students figure out what it is, you can flip the answer, and that way you have that ready. Then roll over to the next question. There was some questions I chose to scatter, and they can come up. They can come up and combine, drag one question to the other. It's matching. The questions will scatter.
But I used the teacher's kit, and this is how it looks. I uploaded pictures of my students. So you can see this is my LD07. It has several components. The first is, you can see my class summary, my class attendance and behavior.
I think of one of my deficits is keeping paper together and making sure that I can know who's doing what when. I don't believe in following students around, and I tell them I'm not going to chase them around like little children, but that I have it on Teacher Kit. We have to get to know people pretty fast, and you get to know, both ends of the continuum. You know who's bright, and you know who's going to be, a challenge, right? But I want to know everybody, and so doing Teacher Kit has been really helpful for me, and I take attendance and I learn people that way.
Having 92 students and having 10 pieces of paper for each student drives you crazy. Crazy, crazy, crazy. So what I was able to do is to document as they completed the growth and development. I was able to document, 100 points. That it's not the quality, but that they actually completed the assignment. And so I can keep track of all of those 9 pieces of paper for each student by just checking off, what they did. And I can also send emails to about the data to different instructors. We have clinical instructors who take the students to the clinical sites. We have lab instructors like Ms. Heather Diaz who work with the students in lab. And then we have the lecture instructors like myself. So I can send information to various members of the faculty for Nursing 2010 to let them know whether their students have completed growth and development, whether they've gone to daycare, whether they've done the trach suctioning.
Because we are in lab and simulation, we of course wanted to do something lab related, and we found the nursing procedures checklist from Davis Mobile. We think it's a pretty good app. The faculty is there just to kind of be around to answer any questions, but they've learned the skill already and they should be practicing it. This will give them guidelines and the steps, because when the NCLEX exam comes around, I'm going to tell you, there's going to be lab questions there, such as, put the following steps in order for this procedure, something like that. We're mostly hands-on, and that's important for our students. Does that make sense? Okay, so that's what we want to do, and we found this checklist. And we're going to show you some of the features on it. Very easy to use. It has a search function for procedure checklists, and you can see them. And right at the top, scroll down for a minute, see where it says principle-based checklist to use with all procedures. If you click on that, it tells you all sorts of things like informed consent if needed, washing hands, checks records, things like that. It allows the person who is doing the procedure or the person checking them off to actually check them off step by step.
They can basically check off the student, have your iPad or iTouch or iPod, and basically just check off whether or not the student, I was going to say patient, whether the student has actually was successful in completing that particular task. And maybe the student didn't do it, so then what I would do is just make a comment that the student was unsuccessful in that particular area.
Forgot this step or something.
And that way they can see, you know, exactly what they did, instead of saying, well, let me get a piece of paper and then we'll make a copy and then you can take this home with you. You'll have it right there in your email address. And as you can see, down at the bottom where it has the pass and the pass or fail or needs practice, all of the information will be there ready for the student.
Provide pictures or rationales for what you're doing. But here's the thing, that's what lab is for, to teach the students how to do it and provide the rationale. Because once they start doing this skill and practicing it, they got the instruction. And so they can then practice on their own, which they do.
And the students can also use this on each other.
Correct.
Even
When
though
you
we
practice.
have the Taylor book for the incoming, the 1020 students, which we're slowly transitioning, but I looked at some of the skills checkoffs and compared to the Davis, this one, and it's pretty consistent.
Yes.
There may be a few things that need to be changed or just noted to the student,
Right.
but
And we
I
can
think
do
it's
that.
a good guideline.
It is.
Clinical, I encourage students to please bring to me what they use in apps. I really feel as faculty, we need to review what apps they're using. And the reason we need to review it became very clear to me in looking at the Psych Drugs. So this is a free app, and it says, it's really funny, it says, eventually we'll charge, or something like that. It was introduced to me by a student who likes to use technology and uses technology well. It has a list of psychotropic meds. It's interesting, 3 out of us had medications in our presentations. It is a weak area of our students. So it does generic name and brand name and class and so on and so forth, and the half-life and the side effects, but very minimal. The pros of this app is that it's user-friendly. It is, students like it, and it can be used during clinical, and it has, for the most part, accurate information. However, well, I'm going to get to that. Here's the cons. You know, medications are complex. It's not like you throw a pill in your mouth and boom, it works. There's no pharmacokinetics. And the thing that's really important is, like, there's no labs. Some of the medications, absolutely you need to have a lab reference. And so you can do a quick and dirty, what is lithium again? You can, but you should have another reference around so that the patient can, or so that the student, there I go, so that the student can look up, you know, what is the therapeutic window of lithium and how do we utilize that, and then compare that to the lab values. So you have to have another drug book, and it seems to be true for all of them. So I would recommend it for quick and dirty, but I also would say that we need med books. It provides 120 skills, and it's basic information on the skills. Again, I saw pretty much accurately, we went through them together. Next slide. It covers assessment, documentation, hygiene, bowel elimination, urinary elimination, and so on and so forth. The one that that I really did is going into the clinical for psychiatry, having those skills was very, very important. And this app did a very good job of delineating how do you do a pain assessment, not just asking the patient, are you in pain 1 through 10. My students used the app to show patients how to do vital signs and why we do vital signs. That was really good, and the patients really liked it. And so I thought that was really excellent. And so pros, easy to find, skills list are detailed, basic is covered, and the other thing is it has good dosage calculation, which is the other thing we worked on. We would really like to have video clips so that when they saw how to put in a Foley, they could actually see how to do that. They have some areas that need changes. For example, they don't have anything on SBAR, and that's how we give report. And they show older style of documentation.
Once you bring the app up, this is how it looks. Actually, if you tap on all, it'll give you the categories of all of the procedures, and they are alphabetized. So like Pam says, it's a good reference. You don't have to search through anything to get to that. Another area was medications. What I didn't like, and I forgot to add on the slide, was the dosage calculation. They do dose ordered over dose on hand. And of course, we use dimensional analysis, so that was another drawback. One of the ones I really like is OBGYN on call. Goes through general GYN complications for that. Another one is OBGYN, and if you click on the different areas, it not only goes through terminology for OB and GYN, but also related concepts that are covered during the semester. Another one is obstetric and gynecology question and answer, and this is really nice. It gives you questions, and it gives you the categories. So if they want to look at anatomy, it gives them 0 to 5 questions. Gives you quizzes and give you a question, so also I could use the clicker for this. So all the OBGYN apps that I do have, I plan to use in the classroom. I think it's too expensive for students to purchase themselves.